respiratory distress syndrome, ARDS जिसे हम कहते हैं. So what is ARDS is also called as shocked lung, wet lung, etc. And acute respiratory distress syndrome is a severe form of acute lung injury characterized by sudden and progressive pulmonary edema, hypoxemia, unresponsive to oxygen supplementation, and the absence of an elevated left atrial pressure. This is the ARDS. अगेन मैं रिपीट कर देती हूँ. ARDS is a severe form of acute lung injury characterized by sudden and progressive pulmonary edema, hypoxemia, unresponsive to oxygen supplementation, and the absence of an elevated left atrial pressure. ARDS occurs due to diffused alveolar damage and lung capillary endothelial injury. Lung fail to maintain balance between oxygen and carbon dioxide because lungs को क्या करना होता है, gases exchange in alveolar part. हम जो inhale करते हैं ऑक्सीजन that will mix with the blood at the alveolar site, and जो body deoxygenate से कार्बन डाइऑक्साइड जो होती है वो through the exhalation body से बाहर निकल जाती है. तो in ARDS जो lungs हैं वो fail हो जाते हैं to maintain balance between oxygen and carbon dioxide. Neutrophil plays a key role in the pathogenesis of ARDS as distant by. ARDS was recognized as most severe form of acute lung injury ALI. अब साइन एंड सिम्टम्स क्या होंगे इसमें? टैकीकार्डिया, टैकीपनिया, increased blood pressure, accessory muscle use for respiration, crepitus, diminished breath sound, cyanosis, diaphoresis, bibasilar crackles, dyspnea, and hypoxia. Okay. Now management इसमें क्या हो सकता है? Mechanical ventilation may be necessary. Vasopressor and diuretic as orders. जो भी diuretics पेशेंट को ऑर्डर किए गए होंगे वो देने हैं, वेजोप्रेसर देने हैं, एंड मैकेनिकल वेंटिलेशन वेरी वेरी इंपॉर्टेंट इन द एक्यूट रेस्पिरेटरी डिस्ट्रेस सिंड्रोम. चलिए एक्यूट रेस्पिरेटरी फेलियर के बारे में बात कर लेते हैं. हाय एवरीवन, जो भी ऑनलाइन है प्लीज़ चैट कर सकते हैं. हेलो हाय मैसेजेस जो है सेंड कर सकते हैं. Now what is acute respiratory failure? Respiratory failure is called when partial oxygen is less than 60 mm of Hg and partial carbon dioxide is more than 50 mm of Hg. जब हम ABG स्टडी करते हैं आर्टेरियल ब्लड गैस वैल्यूज़, तब हम जो है इसमें पार्शियल ऑक्सीजन और कार्बन डाइऑक्साइड के बारे में स्टडी करते हैं. सो जब पार्शियल ऑक्सीजन जो है वो लेस देन 60 mm ऑफ Hg हो जाए, अब आप मुझे कमेंट बॉक्स में बताएं कि कितना ये होना चाहिए. हाँ, जब लेस देन 60 ये होता है तब, एंड व्हेन कार्बन डाइऑक्साइड जो मोर देन 50 mm Hg हो जाए तब हमारा एक्यूट रेस्पिरेटरी फेलियर जो है वो होता है. इटियोलॉजी, कॉजेज क्या है इसके? कलेक्शन ऑफ सिक्रीशन इन द लंग्स ड्यू टू कफ सप्रेशन, ब्रोंकोस्पाज्म एंड एयरवे इरिटेंट्स. Central nervous system depression, disorder of respiratory muscles, peripheral nervous system and chest wall, endocrine or metabolic disorder, heart failure, gas exchange failure, MI and pulmonary embolism. साइन एंड सिम्टम्स इसमें क्या आएंगे? एब्सेंस ब्रीथ साउंड, बैट साउंड, ronchi, crackles and wheeze all, yawning and use of excessive muscle for breathing. ट्रीटमेंट इसमें क्या चलेगा? ऑक्सीजन थेरेपी, मैकेनिकल वेंटिलेशन, bronchodilators such as terbutaline, albuterol, theophylline, and ipratropium bromide. Okay, is there anyone you can say hi, or you can chat, or you can ask any questions, or simply you can chat? You can tell from where you are and how do you like the classes, Poorvi Nursing classes. चलिए साथ साथ में एक टॉपिक भी डिस्कस कर लेते हैं. सो एस्थमा, व्हाट इज एस्थमा? इज अ क्रॉनिक disease characterized by recurrent attack of breathlessness and wheezing, shortness of breath, and chest tightness. During an asthma attack, the lining of bronchial tubes, airway swell हो जाते हैं, causing the airway to narrow, turn more sensitive to irritants in the environment, and thus reducing the flow of air into and out of the lungs. It is probably caused by interplay of hereditary and environmental factor like an inherited tendency to develop allergy called as atopy. Next, children with eczema or food allergy are more likely to develop asthma than the older children. Two type of asthma, one is allergic and one is non-allergic. One, what is allergic asthma? IgE mediated or extrinsic asthma cause are dust pollution, etc. In non-allergic, intrinsic asthma or non-IgE mediated cause drug like aspirin, exercise, respiratory tract infection. That's why they are called as non-allergic. Diagnosis, what we can do the diagnosis: medical history, chest x-ray, physical examination, LFT, liver function test and lab test, radio allergosorbent test, RAST जिसे हम कहते हैं, to test the specific allergen in the blood. क्या दे सकते हैं हम इसमें? सल्ब्यूटामोल, लीवोसल्ब्यूटामोल एंड टर्ब्यूटालिन are utilized in stopping asthma attack. Short courses of corticosteroid and other oral injectable may be required during acute attack or are to be used after medical advice. One condition is there in asthma, that is acute severe asthma or status asthmaticus is an acute exacerbation of asthma that remain unresponsive to initial treatment with bronchodilators. Okay, so sign and symptom: tachypnea and significant wheezing. Normally, the difference in the systolic SBP between inspiration and expiration does not exceed 15 mm of Hg. In patient with severe asthma, a difference of greater than 25 mg may be noted, which is known as pulsus paradoxus. Pulsus paradoxus. फर्स्ट लाइन ट्रीटमेंट्स में हम क्या देंगे? ब्रोंकोडायलेटर ट्रीटमेंट विद बीटा 2 agonist, typically salbutamol. The inhaled route is most effective. Then anticholinergic agent ipratropium bromide does not cross the blood-brain barrier and is the recommended agent of choice. Then glucocorticoids are the most important treatment for status asthmaticus. Action usually require at least 4 to 6 hours to occur because protein synthesis is required before the initiation of its anti-inflammatory effects. This is the asthma. Should I take the classes? आगे डिस्कस करें? Okay, we will talk about bronchitis later. Okay, we should complete. So, what is bronchitis? Bronchitis is an inflammation of the mucous membrane of the bronchi. Bronchitis can be divided into acute and chronic. Acute bronchitis is characterized by feeling of cough, small sensation in the back of the throat. It can be with or without the sputum. Acute bronchitis is one of the most common type of lung infection. It can occur at any age. Chronic bronchitis is a type of COPD which involve a cough that produces sputum for 3 months or 2 consecutive years. Main symptom bronchitis is persistent cough with the thick yellow gray mucus, though it may not be always be present. Other symptoms of bronchitis may include a tight feeling in chest, breathlessness, wheezing, sore throat, slight fever and chills, headache, blocked nose and sinus, body aches and pains. Virus or bacteria, viral bronchitis is a much more common. Bronchitis can also be caused by breathing irritant substance such as smoke, chemicals in the household products or tobacco smoke. For managing acute bronchitis, advise the patient to take rest. Drink plenty of fluids. Headache and body aches can be treated with painkiller like paracetamol or brufen. Stop smoking or inhaling irritants. And in the chronic bronchitis, we should advise there is no cure for COPD, but management can help slow the progression of the condition and reduce symptoms. Smoking should be stopped to avoid further damage to the lungs. Thank you, everyone.